Today, millions of people around the world admit to suffering from symptoms of fatigue and depression. Up to this point, the remedy for these types of problems has been either psychotherapy or antidepressant medication. However, there is also evidence suggesting that the symptoms commonly associated with fatigue and depression may be attributed to a wide variety of thyroid disorders. In this clip, Dr. Ruth Buczynski interviews Dr. David Brownstein about his remarkable holistic approach to the treatment of thyroid disorders.
Our guest today is Dr. David Brownstein. He's a family physician who utilizes the best of conventional and alternative therapies. I'd like to ask you, David, could you just give us a short orientation to the thyroid gland and why it's so important?
Well, Ruth, the thyroid gland sits in the lower part of our neck, and it weighs about 1.5 ounces. It produces about a teaspoon of thyroid hormone for a whole year, and that teaspoon of thyroid hormone has to drive the metabolic rate of every one of our trillions of cells 24 hours a day, 7 days a week. And little variations in that teaspoon of production of thyroid hormone have big effects on the body.
Okay, so let's get right in then to thyroid disease and how it is sometimes misdiagnosed as depression.
Well, certainly any of us in practice, and I don't think it matters whether you're a family physician or a mental health care practitioner, know that the two biggest complaints that we see from our patients are fatigue and depression. The problem is that there are too many medications to treat symptoms of depression.
So what happens when treating what you think is depression with antidepressants when it's really a thyroid problem underlying what the patient is complaining of?
I think that antidepressant medications have their place, but I think that they're just way overused, and I think before putting someone on antidepressant medication, patients deserve a complete physical and history and a complete endocrine workup to rule out other causes, underlying causes such as hypothyroidism.
In addition to depression, there are several other symptoms that a patient seeing a psychotherapist might complain of that could be indicative of a thyroid problem. We had talked about fatigue, insomnia, weight gain, brain fog. Those are all possible symptoms of a thyroid issue?
Oh, absolutely. And anxiety should be thrown into that mix.
Okay.
And there's no question those should all be considered as a thyroid problem. And certainly not everybody that has these has a thyroid problem. But if my numbers are correct, and about 40 to 50% of the population has an undiagnosed abnormal thyroid problem, that would explain this explosion of anxiety, depression, fatigue, brain fog, apathy, symptoms that we're seeing in all these patients versus all of a sudden it's just crept upon us that, half the population is depressed and anxious and fatigued, which I don't necessarily think is the case. I think they have underlying physiologic problems that need to be rebalanced.
You talk about in your book about a patient named Ellis, or that's what you named him in your book, a 61-year-old patient who'd had his first heart attack at age 41. Can you tell us that story?
Well, Ellis was my father. That's how I sort of got involved in holistic medicine. My story goes that I had wanted to be a physician since I was little and geared my training at the University of Michigan for becoming a physician. And now during this whole time that I'm in growing up and in training and undergrad and medical school, the whole 9 yards, my father was suffering from severe heart disease. He had his first heart attack at age 40. He had a second heart attack shortly thereafter. He had angioplasties and bypass surgeries and type 2 diabetes, and my father smoked and was overweight and didn't eat good and never exercised, never really took care of himself. And as I started practicing conventional medicine, he was pretty much dying at that point. It was at that time a patient had given me a book, Healing with Nutrition, by Dr. Jonathan Wright, who was an allopathic physician. I also found at that time in my career that I was very unhappy about what I was doing. I found myself prescribing one drug after another drug after another drug and not seeing patients improve. And literally I woke up one morning and told my wife, I don't want to be a doctor anymore. And that was right about the time I met that patient. He gave me that book. And so I looked at the book one day, and there was a chapter on cardiovascular disease. And this doctor thought that it was a underlying cause of many cardiovascular patients was thyroid problems. So I read his chapter. I called my dad in the office the next day and drew some blood work on him. I had my dad do his basal body temperatures. Now, my dad's blood work came back in the normal range, but on the lower side of the normal range. My dad had very low basal body temperatures, almost undetectable with a basal thermometer. He met many symptoms of low thyroid. He was tired, he was depressed, he was cold all the time, he had dry skin, he was constipated, he had problems with his weight, his hair was falling out, his nails were cracking, a host of signs to meet the diagnosis. And I elected to put my dad on a small course of thyroid hormones. And literally within a week of doing that, his 25-year history of angina melted away.
There's a lot more to learn. For more information, visit our blog at www.nicabm.com/nicabmblog or attend a free teleseminar at www.nicabm.com/teleseminar/2009. This December, NICABM will host its 21st International Psychology of Health, Immunity, and Disease Conference on the beautiful Hilton Head Island in South Carolina. Hundreds of practitioners will be coming from all over the United States and many parts of the world. Among the nearly 50 speakers, Dr. Brownstein will be giving a masterclass on thyroid disorders, a holistic approach. There will be several other sessions on related topics, including the cortisol connection, why stress makes you fat and ruins your health, healthy sleep and dreams, an integrative approach, a comprehensive program to prevent and reduce inflammation, and vitamin D3, key to a healthy brain and mind. To see more information about the December conference and to sign up to attend and receive CEU credits, please visit www.nicabm.com/DECCON09.